today's session, I'm Catherine Longer. I am giving you your welcome. Akmal is going to be speaking to us as soon as I finish speaking, and then you'll have 10 minutes of questions, and then Gaina will be coming in and she will be speaking for 10 minutes, and then we'll have 10 minutes questions, and then hopefully we'll have space for group discussions. Both our speakers today need to leave on time, so they won't be able to stay on beyond the time that they're leaving, but I will still be here so that if you need to stay on, if you want to ask any questions, then you can. Really quickly, what this is not, Hub Cymru Africa is not the funder. We are not the grant manager for the Wales Africa grant. We were about 20 years ago. We are no longer. So WCVA are the grant manager, and so those are the people that you send your application to. The Welsh Government, Wales Africa Department, they are the funder, and they will decide how they award the money, so to which applications to award the money. They have a panel that reviews the applications. You can only apply for the Wales Africa grant, which is the grant we're talking about today, if you are based in Wales and have a partner in sub-Saharan Africa, in a sub-Saharan African country. Hub Cymru Africa, that's us, myself and Beth. We are not in a position to be able to match Welsh and African organisations. I'm really sorry. I know that a lot of people are looking for that, but I'm sorry, it's not something that we're able to facilitate. Okay, over to you. I'm going to turn myself off mute and hand over to you, Akmal.
Thank you so much, Kath, and thank you for the opportunity. It is really a wonderful opportunity for us to actually discuss some of the key points. So I've been given 10 minutes, so I'll try to be brief in terms of what we are doing. So if we can just, if I can give you a context of who I am and what our organization is working, it will be a great opportunity for you to understand. So basically from a background point of view, we are a Sadakat Community Finance, ACF for short, and we are an organization not for profit, delivering training programs and skill development and access to interest-free finance. So we have been doing a lot of work with the women organizations. So if we can have next slide, please, Kath, if I can. Yeah, so really our vision and mission is to be able to help Black and minority ethnic communities in Wales and beyond. And we've done a lot of work now in Africa, especially in Ghana, and we're looking at Namibia and also in Sierra Leone as well. So there's few bits that we are doing. Our focus is to empower women and young people, and that's the kind of the program that we are doing here in UK as well as in Africa. So this is a very innovative model for social and economic change. And the two programs that I mentioned are essentially focused on women, which is the ACF Women Entrepreneurship Program, and on youth, which is the ACF Youth Changemakers Award Program. So I won't go too much into the detail, but I will get on to sharing my screen in terms of what we think would be a good application. And this is basically to help you not to make the mistakes that we did. Is it okay if I can share the screen, or would you, Kath, you've got all the things there together?
Sorry, you should now be able to share your screen.
Should I?
If you want to try again, sorry.
Yeah, okay, thank you. Thank you very much. So hope you can see my screen at the moment. Yeah, okay. So yeah, basically, I can just make a little bit. bigger just in case. So what I've done, and thank you to Kath for helping me to put it in this format. So in the first one here, you will see before. So I'm just highlighting this before, and then the application that we did. So if you will see on this column, I'll show you what we said and what was the comments, which is the second, the bluish column that we've got is for comment, and how then we changed it to the after, means that that was the application that we did. So when to start with, I think the main question for all organizations, what you are going to be applying for, is the project title. Now, in my when I applied for the application, I just put something which was supposed to be as it is on the tin. So it was basically us, ACF, and our partner in Ghana, SEED, Center for Evaluation and Development. And we just called it ACF SEED Entrepreneurship Program. So to me, it looked okay, obviously because I was part of it and I knew it. But the comments that came back, and I just want to mention here that we didn't get the first round successful in the first round. So all this little orangish or pinkish kind of color that you might see on the screen, this is all that we wrote before of an unsuccessful application. So we just wrote ACF Women Entrepreneurship Program, and the response, the feedback, and obviously we got that, we don't have much information and what you're doing and all that. So the response when we contacted African Hub Cymru, for some feedback and suggestions, the response that came was that this does not say what the project does and is a bit uninteresting. Now, that was very interesting for me to say that it's uninteresting, because I thought that, okay, we'll just write what we are doing and that's it, But then we, had a meeting and worked with our partners in Ghana. So we spent a couple of hours, to say, okay, what we can call. So we came up with a very nice, I think, so I like it now. It's saying skills for sustainable livelihoods, developing women entrepreneurial skills in rural Accra, Ghana. Now, so what it is saying now, and I agree, is that it shows very clearly what we are doing. We are offering skills for sustainable livelihoods. And that was one of the categories that we had applied for sustainable livelihood. So that was good for skills. But this also gave us developing women entrepreneurial skills in rural Accra in Ghana. So Accra, as you know, is a capital for Ghana. And it also exactly said what we were doing, where we were doing, and what this project was all about. So make sure that if you can, may spend some time in trying to get this title right. Okay, so that's my first point. The second point, which I wanted to cover, is that in all applications, and especially the WCVA application form, we will get this, please provide a short project description of how the funding would be used. Now, you can see in that sort of the first column, the first application that we were not successful, I wrote lots of things. ACF is doing this, and it is going to package tailored focused support involving combination of measures. It'll be skills, training, advice. It will be interest-free finance, supporting aspiring, and all that, And the response that I got was to say that this does not say how the funding will be used. Now, how was the one which was very softly touched, but not really a description in a much granular form. Okay. So we changed it again. We spent almost a couple of hours to say, and you see, the tempting thing I had was that I was trying to fill in the words which were allocated words, So I think it was about 100 words or something like that. So I tried to push this, that, oh, my description is going to be great, So don't do that. And you can see that I've covered the sentence that really made it happen for the successful application was the funding will primarily be used for the delivery of entrepreneurship training program covering marketing, overheads, and travel. Okay, full stop. And I didn't worry about the word count there. Okay, I didn't think that, oh, well, it's too brief. I don't know what it is, but it has got all the heads that I wanted to cover. Okay, so that's very important that in your project description of how the funding would be used, make sure that you write a note of all those funding heads that you want it to be covered. So this will help you to be able to get onto the funding because that will break up all the points. I mean, there are some smaller points as well, but in the main, this is what it will cover. The third thing, what I wanted to share with you is please explain the need for this activity and your experience of working with identified partner. Now, if I show you how much I wrote about it, because I really wanted to impress my, the people who wanted to give me the funding. So I wrote everything, and you can see I've written quite a lot of things over here. But the feedback that I got was where it says that please explain the need of this activity and your experience of working with your identified African partner. Now, obviously, it was looking for some kind of evidence of the need that we are going to, but I was covering quite a lot of this, which wasn't covering the need. I was connecting on all my strengths and, what we had done and how we met together and how this partnership came into it. So it wasn't coming up to answering, and the feedback was correct to say, this example is only a snippet of the section on need, which contained a lot more information. So clearly I was not addressing the point, but I was just giving lots of things which were not necessary. So, but for the purpose of fundraising community, it is worth noting that as an opening paragraph in the initial application, its approach to how the need was identified does not come across, okay? So we changed it to our experience of supporting women and youth-led and run businesses has given access to collect and analyze data through interviews, so which is all that evidence that we had. Key informant interviews, focus groups, and discussions. The results showed that the women had limited access to skills and resources required for their non-farm activities. Now, here you can see we are saying that which sector we are going to be doing. So it's an agriculture country. So this was something which we wanted to do. The results further showed that personal attributes of women enhance the decision-making and resources access. These dynamics inform the creation of the project to help women and youth improve their skills and explore their opportunities in non-farm activities for better living standards and sustainable livelihoods. So I think it gives a very clear idea to the person who is going to decide what we are doing and how we are doing it. So I must say that I would like to stop here with the 3 points that I mentioned, because there may be some questions, but these are the 3 elements that I think will focus the people on to your application. And once you've got the details and the whole financial plan and all that, that is added information, but this captures the interest. So I'll stop here, and I will perhaps leave the screen open for the moment, just for reference, if you guys want to ask a question, but open to any questions. Thank you.
Thank you very much. That was really lovely, nice and concise. Does anybody have any questions? You can either take yourself off mute or put a a question in the chat. Janet, please go ahead.
The last few applications we submitted, we didn't get any feedback. Is that normal? Is it possible to get more feedback? Because actually, what's so interesting here is that I can see that you've been able to respond to the feedback and improve. So that's quite important.
Yeah, thank you, Janet. Because we didn't get successful in the first round, so they asked us that if we could contact the African Hub, and we then contacted them, and we were then designated with two of the key colleagues who actually asked us that, could you send us the application? So once we sent them the application, we had a session with them, almost, about 2 hours or so, to be able to look at that and explain what we were doing and how we were doing it. So they went back and then they sent us some of the annotations to say that, okay, this is what we feel. So I think what it means is that if you have not been successful, then it may be worth everyone's while to actually contact Hub Cymru to be able to see if we can get some more information. But it's to answer your question, that as an automated or automatic feedback, no, it was, we had to go to them to ask them that we need help. Yeah.
Thanks.
Yeah.
Thanks for the plug there. So
no, I think it is a very positive plug, and I really am grateful for the help which Hub Cymru is doing, and very valuable work. Yeah.
Good, thank you. Ian, I think you had a question.
Yeah, just briefly. Thank you for that question and for that answer, because it asked a question that I wanted to answer. Because the feedback we got from our last WCVA application was, your project is too expensive or too complicated or something. And we were applying for a small proportion of the project. And I don't think they'd understood that at all. So it's probably my fault for not writing it carefully, but thank you. Anyway, at the moment, that's all I want to say. That's very useful.
I think, Ian, just to very quickly show you my screen. You see I didn't have time to cover. Please describe your project and how it will make demonstrative contribution to the priority. So we did the same, what you are saying now, because you can see how long this was, that the work programs and this and that. And so it was all very complicated. So this one, then we just made activity 1, activity 2, and outcomes, and that's it.
Yeah.
So, yeah, I think it will help.
Thank you.
Thanks, Ian.
Akmal, would you be okay if we shared this document with the people who've attended today? Would you feel comfortable with that?
Yeah, more than happy.
Sorry, I should have asked you not on screen, shouldn't I? But I'll ask you afterwards, so you can say no if you want.
Yeah. As long as it is confidential amongst all the participants, that's fine. Because obviously, I don't know what's the policy with like WCVA and all that, but there's nothing really.
Okay.
It just shows what it is. You can see the same thing on our website. Not quite in the question answer form, but the work that we do and all that. So it's all public information.
Okay, great. All right, lovely. Well, maybe we'll have a quick chat about it afterwards, just to make sure that it's all okay. But if it is, then we can share it with those people who've come today. Right. We can't do round applauses on Zoom, but thank you very much for sharing your experience with us and for sharing your learning. Really appreciate you giving us your time. Thank you.
No, it's a pleasure. Thank you very much. And I wish you all the best. And again, through Kath and the team, if there's anything that I can help. I mean, at least this is the first project that we have been very successful, and hopefully we will be applying again. So anytime you need my help, I'm more than happy to do that.
Thank you very much. We really appreciate it.
Thank you. I've got to go to another meeting, so I wanted to stay, but if you will excuse me.
Thank you.
Thank you, everyone. Take care.
Bye.
All the best. Bye.
Bye.
Bye. Bye.
Okay, so we will zip really quickly through this because you've all seen these slides. And I'm going to invite to the stage Gaynor. Are you able to take yourself off mute, please?
Yes.
Hi, how are you?
Hello, everybody. I'm fine. I'm fine. Sorry, I wasn't here at the beginning. Do you want me to introduce myself, Kath?
Please, if you could, that would be great.
Yeah, so I'm Gaynor Penrose. I'm here on behalf of PONT, which stands for Partnership Overseas Networking Trust. And I'm really chuffed to see my fellow PONT person, Marga, who's also on the call. So hi, Marga. It's lovely to see you, because Marga's just come back from Uganda. I've just come back from Uganda, but Marga was there longer than me, which I was very jealous about. So our charity works in Mbale, which is in eastern Uganda, and so I'm particularly involved with the healthcare side of things. I'm a GP by profession, but PONT does lots of stuff. So it does has a livelihoods program, education, 100 schools, over 100 schools twinned in Rondakan and Taff and Mbale region. We have engineering projects, we have environment projects, there's lots of different things going on. So, but particularly for me, it was about me applying for a grant for to train health workers, new community health workers. Do you want me just to carry on, Kath?
Sorry, yes. Next slide. So we're going straight into the before and after, but I think the audience will be aware of the format by now, hopefully.
Right, fine. Okay, so I was very new to all this fundraising thing, never done it before, and I suddenly sort of found myself leading a committee for health for PONT with no prior experience of anything like this. So my first funding bid, I wrote it and I was quite pleased with it, thought it was quite good, but clearly it wasn't successful. Like our previous speaker, I sought some advice from Hub Cymru Africa after that, just to see what was wrong with it, how can we improve it. So I had some excellent advice from Hub Cymru Africa, and particularly from Kath, and that made a massive difference when we resubmitted the bid. We got it, which was really amazing. The other thing just to say was, as well as from Hub Cymru, I also went back to the WCVA and asked them for more feedback, because like the rest of you, just have been very nothing very official. And that was really helpful. And I think Hub Cymru gave me an email of somebody, I think it might have been Matt Dorr, maybe, I'm making that up, in WCVA, and I contacted him and he actually phoned me rather than doing it by email. He said, I just thought it was easy to give you a ring. So we had a really nice chat for about 15 minutes, and he kind of literally went through my application and what the people looking at it had said about it. And most of what they said about it was very good, actually, but he just said there's for me a key thing was he felt we could have showed better value for money, so I'm going to come on to that. But it was useful, and there were a couple of other bits he said maybe could have said a bit more about that, or we didn't fully understand that or whatever. So I'd advise you to actually contact WCVA as well if you've been unsuccessful in an application and ask for some proper feedback. That was really helpful. Right, so I've just got three things to go through here. I'm not going to be very long. So the first bit was that short paragraph near the beginning where it says, how is the funding going to be used? Well, I didn't really realise how critical that bit actually was. So I just before, I mean, it does tell you how it's going to be used, but it was just very factual and quite boring. So as you can see, we're going to train 240 more community health workers, how they'll be identified. We're going to train them on this program, who's going to teach it, and it'll provide healthcare to 120,000 people. But what I realised was is that if you look on all the who's got successful grants and stuff on the WCVA website, you'll see successful grants, and then literally this little summary is there. And also I realised that some of the people on the panel who make the decisions haven't read your entire grant. A lot have your entire application. A lot have, but there's some people who literally have not read much more than your brief summary, but are helping to make the decision. So it made me realise that actually that initial summary needs to be much sharper, a little bit more emotional. So you can see what I've changed it to. So I changed it to try, basically sexed it up a bit, basically. So I put critical capacity building, and then talked about the people without any existing healthcare. So I'm just saying this is bad, they haven't got any healthcare. And what we're going to do, we're going to give them access to life-saving disease identification, etc., through training these new health workers. And this is going to plug large and then identified gaps. So we're not just going and doing what we think's right. This has been identified. So it was a summary, but a little bit more dramatic, and maybe just grabs the attention a little bit more. So that's what I did there. So if we can go on to the next slide then, Kath, please. So this is explaining the need for the project. So what problems? So when I wrote my application, I very much tried to follow all the questions that had been asked on the WCVA website. So I really tried to go with that. So I went with what problem. So yeah, the first time it was again a bit sort of boring. I was really just, I suppose, kind of muddling up slightly with, I don't know, needs assessment. I wasn't really saying what the problem was. I was just kind of saying that we've met with people and they've told us there's gaps in the healthcare provision, and so we're going to train some health workers. So that was my first attempt, and obviously that wasn't successful. So then maybe we can just go on to the next one. So this is my second attempt. So this isn't the one that I submitted, but I'm thinking now, right, you need to make this much more kind of punchy. Some advice that I had from Kath as well was that when you're writing a bid, you need to write it as if you're writing to an impatient person. So like, don't be too waffly, be quite clear in your language. So I even sort of put some quite short sentences in. I'm trying to be a bit more punchy and trying to grab the attention. So I've got things like villages in Mbale are dying from lack of basic healthcare. Children are dying from preventable diseases such as diarrhea and malaria. Women and babies are dying from complications in childbirth. So that's good, that's punchy. And we can do something about this, because we can train some health workers, and we know it's had a big effect because we've got we know that mortality rates have gone down. So that, it's good stuff. All right. But anyway, my chatting with Kath about it some more, she said you can make this even better. You need to put some proper statistics in. So apart from I've put in some something about how the mortality rates have gone down and things like that there. And later in my final application, I put some kind of numbers in and things like that. But if you look at my final attempt, I actually added in some statistics. So this is trying to explain sort of what the problem is. So I was advised to go and look for some international data, or if you could find some Ugandan health data. That was harder to find, to be honest, but UNICEF and WHO have got, World Health Organization have got plenty of stuff sort of to find. So I basically put some stats just to show that children in Uganda are 10 times more likely to die before the age of 5 than in the UK, what the leading causes of death are, and that really most of these can be prevented or treated with access to very basic interventions in health and sanitation. And then I put a quote in then for the World Health Organization about how just these basic things can save many young lives. So I was advised to do that, and it definitely just gives it a bit more weight, having some statistics from some sort of official people. It wasn't just Gaynor saying this or whatever. It's a problem. We know it's a problem because the World Health Organization say it's a problem. UNICEF say it's a problem. And then just to go on to say, to really say, well, that there is a course available, and we have got NGOs there who would train them, but the real problem is the limited resources in the Ugandan health system. So we kind of know what we need, but because of limited resources, we can't do it. So that was me just trying to explain the need a bit better. So I think adding in some statistics is really good. The other stuff you saw in those previous attempts, all that stuff was put in somewhere else in the application, but it was just trying to make the problem that I'm trying to address kind of just much more tangible and to give it some real weight. Yeah, so I advise you doing that. So that's that bit, and then the final bit is really just to look at our project profile. And so when I told you that that when I got some feedback from the WCVA, they said, well, to be honest, yeah, your application was good. They said it was very good. There's lots of really good stuff in it. But the problem is other organisations showed better value for money than you, is what they said. Yeah. So you've got to somehow show better value for money. So I was like, gosh, how on earth am I going to do that? I don't know. So again, Hub Cymru Africa came up trumps, and so we were assigned Kath, and we spoke to Kath about it, and she came up with a marvelous idea to just really show the value for money. So you can see the project profile there, the bottom of it. So the top bits you've got staff, you can't see, but staff costs and project costs. But the bottom bit you've got volunteer time and in-kind costs. And so at the minute we've just got 2 volunteer managers going out at the beginning and the end, and then we've got some travel and accommodation, and that was kind of it. But she said, well, how about you actually work out what the worth of all these volunteer health workers that you want to train. So you want to train 240 new community health workers. Let's just try and work out what if we were paying them like a living wage in Wales, what would they be worth? So Kath and I sat with a bit of paper and we just jotted it down. So if we can just, onto this one, we're onto it now. Can you see on the volunteer time bit? So I've added in 240 volunteer community health workers training for 200 hours. So they're doing a 5-week course. Plus they're going to do 20 hours of work per week for the rest of the year. So I checked that all out with my Ugandan partner. So we added it all up. So it worked out that each community health worker was actually going to be working with volunteer time for 1,140 hours in a year. So then we gave them a wage, which was on the project profile, a suggested sort of wage. We gave them that wage, and we actually worked out that these community health workers were worth £11,286, at least in our sort of terms. And of course, I was going to train 240 of them. So gosh, look what that came out. So it came out as £2.7 million, which I showed across. I just divided it by 4 and put it across the 4 quarters. So I need to just get out of the way so I can see the bottom of this. Can you see bottom right hand corner? So we requested nearly the full amount, so £24,901.20 I requested. But can you see that actually the total in-kind project costs were 2.7 million. So you sort of add it all up, so that is massive. And I thought I dare you to to say that I'm not showing value for money now. So that was a real lesson to me, and it worked. So yes, I think that's all I wanted to say, Kath. I'm happy for anybody to ask me questions.
Thank you very much. That was really, really helpful, Gaynor. I really appreciate it. Thank you very much. Does anybody have any questions? I think what I will do is stop sharing so that we can see each other a bit. But again, you won't be on the screen unless you take yourself off mute. But you're very much welcome to take yourselves off mute and ask in a question, or you can put it in the chat. Janet, go ahead.
So, Gaynor, if I can just put you on the spot, if that's all right.
Yeah.
So in that particular application, how did you answer the question about the benefit to Wales?
Right. So I looked at our entire organisation. So not just on. So I broke it down. I'm just trying to find the bit that I actually wrote. Sorry, in my application. Hang on a sec. I can tell you actually. Gosh, where is it? Benefit to Wales. Yeah, here we go. So I talked about it in a personal kind of way first. So how it was benefiting me and other healthcare professionals. So I talked about how that I and other healthcare professionals involved in this would become better practitioners due to increased world experience. How when we consult with patients of East African descent, we've got a better understanding of their cultural sort of nuances and that kind of thing. We were also about to do a mental health course, which we've just delivered a few weeks ago in Uganda. So I talked about how we were going to work together, learning from the Ugandan team, working with the Welsh team, and you know, about how I publicise what we're doing, why I do like in my practice and things like that. We talked about schools, particularly because schools is a big part of what we do. And so we just talked about how the 100 schools that we've got in Rhondda and Taff are learning about healthcare in Africa and about the similarities and the differences. And, you know, that they're sort of learning about us training health workers, that kind of thing. I talked about, we've taken some youngsters out to Uganda as well with our charity, and some of them want to do health jobs or that kind of thing. And, you know, the benefit to them of going. And what else did I say? So I talked about the next generation, yeah. So schools and taking youngsters out. Talked about communities and just saying how we can all benefit by if we by using our sort of media team, social media, and taking opportunities to have stalls at different events, maybe doing radio interviews, you know, putting articles. In the past, people put articles in the newspaper, things like that. The whole what we do can be publicised, and therefore the wider community, you know, benefits and has increased awareness of people living in Uganda, and particularly healthcare and things, and you know, being more likely to want to support through giving and fundraising. So they, in fact, actually one bit of feedback I had was be more specific, exactly, about, yeah, be more specific about how it's benefiting communities or something like that. So or how you're showing that you're benefiting communities. So I literally asked everyone in my organisation, right, what, you know, where have you advertised PONT? You know, what events have you been to? What interviews have you done? And I wrote them all down, put that in. And just said, you know, we publicised it at this, and this, and therefore, you know, that's reaching loads of people, and that's going to benefit the whole community. So it was that kind of thing.
Thank you, Gaynor.
Brilliant, thank you. I think Ian has a question next. You, Ian?
Yeah, thanks. Sorry, I'm just unmuting. My video isn't working, hence the blank screen. Thank you for that. That was really interesting. I must say, I get really annoyed when funders ask for value for money things, because in your case, you're clearly demonstrating value for money in a almost over-ambitious way, because you're just using a huge amount of money. I could do the same for all my bids, but it wouldn't be true, because they're estimates, aren't they? In a sense. I mean, if I said that, you know, it would improve the livelihoods of 500 artisans in Tanzania and improve their livelihoods by £40,000 a year in UK money, it wouldn't be true. So it's almost, I get annoyed because I feel it's almost like cheating. I'd rather put it into actual terms of the actual benefit to the people there in Tanzanian shillings. They'll be able to earn, you know, $3 a day instead of $1 a day, or something like that. And I'm just wondering what Kath would have to say about that, because we've had this discussion before, I know, in the past. You know, when our last bid got rejected because of probably value for money, I felt that, you know, I could have bumped it up, but, you know, I was using our volunteer time, not their volunteer time.
Thanks for your question, Ian. I think there's a couple of points there. One, I think that it's again, I'm not the funder, so I can't say, but from my personal kind of belief, and again, I know Beth is on the call, or I think she's, yes, Beth is there, so she can always jump in if she has any thoughts to add. But I think in your instance, it is about income. And so you can talk about the monetary value in terms of projected or estimated future earning. That, you know, you're saying that the groups that you will work with will increase their income, or you expect that they will increase their income, and you can make a guesstimation about that. And that is worth putting in. You maybe won't be able to put it in your budget, but you will be able to talk about that in the narrative of your application. In Gainer situation, the community health workers are volunteers. So they are volunteers in the same way that the volunteers in Wales are giving up the time. The community health workers in Uganda are giving up their time. And I think that it's equitable to recognise that time in the same way as you would for somebody from Wales. So I think the difference is, Ian, is how you guys are set up, and that makes the difference in terms of the budget doesn't ask for people who are paid by somebody outside of the project, but it does ask for the monetary value of volunteer hours, of volunteer time. I'm not sure if I've been clear with that. Beth, do you have anything to?
That's perfectly clear. And I wasn't being critical of gainers at all. It was just this whole thing gets me sometimes, you know, when you're talking about volunteer time and money. We all give our time. I give 30 hours a week to my charity, and if I costed that, you know, it would make quite a difference to the bid, but I never do, because I don't believe in doing that.
I think the only thing I would add, just talking about the kind of increase in income, and I know that can sometimes be tricky, you know, having conversations with people about their income is never comfortable. So there are kind of proxy things that you can say around, you know, people in the community will be able to have 2 hot meals a day instead of 1, or they'll be able to put, you know, a tin roof as opposed to a thatch roof, and kind of those kind of indicators of increased income without having to talk about actual monetary figures. So just to flag that as well.
Yeah. Thank you.
Yeah. And the stories that go with that can be quite impactful as well. If you can give a brief, because it's a funding application, not a report, but a brief case study of an incident where, you know, you could say the change that has happened. You know, so Marga was part of our project, and now she's able to do this, where before that wasn't the situation. So I'm babbling a little bit, I'm sorry. That wasn't very succinct. Gaynor, I am a little bit aware that you need to go in a minute, don't you? So we've got 2 minutes if anybody has a quick question for Gaynor before we wish her goodbye. No, okay. Gaynor, you are free to go. Thank you. Thank you very much for giving us your time and for sharing that with us. We really appreciate it. I found it really helpful.
You're welcome. Okay, take care.
Take
Bye-bye.
care. Bye.